Hi all, my name's Ian Roddis. I'm Deputy Chief Digital Information Officer at Kettering General Hospital, and I'd like to tell you about RPA at KGH. And RPA stands for Robotic Process Automation. So this is a story about both an issue and an opportunity that presented itself to us. In terms of the issue, COVID brought with it significant reporting requirements to help understand the daily situation in the hospital and to feed into the national position. Every day at 11 o'clock, the COVID status of staff and patients and the general state of the patient flow and bed status within the hospital had to be compiled and sent into NHS England. If you work in hospitals, you'll know this is a moderately complex reporting process that draws data from multiple systems, including staff systems, patient systems, and general BI reporting tools. It took many hours of staff time each week, and you may understand that it was quite a pressured deal within the hospital, drawing that information from more than 25 wards. And the opportunity, well, it presented itself. Through COVID times, the NHSx AI, Artificial Intelligence Lab, was looking to see what processes could be automated across the NHS. The AI Lab asked Human Plus, an automation agency, to suggest some pilots, and they reached out to trusts across the country. And we, as is our want, said yes. We scoped a number of processes, and for obvious reasons, NHSx supported the automation of the COVID sitrep reporting process. And if you don't know what RPA is, robotic process automation is the process of automating any business operation with the help of robots. No physical robots, but simply software processes. And those robot workers do things that a human does. It logs into electronic staff record, it uses Microsoft Teams, it sends emails, extracts data, it mashes data together. And the thing about robot workers are they do it faster, they do it 24 hours a day, 7 days a week, and they do it with reduced error. Any rules-driven process can be automated. An RPA usually uses a cloud-based platform, in our case Blue Prism, and payment by the number of robot workers. And so this was Kettering on Easter Sunday. I know that because we were delivering Easter eggs across the trust. In front of me are two volunteers, the Chief of Surgery and the Deputy Medical Director. And why this is interesting is just to take us back. This was the peak at the time, we now know. But even through this period, we were interested in innovating to meet patient needs. And I think it's quite cool that local trusts are able and willing to respond to national initiatives to give benefit to our patients and staff. And KGH is like many trusts. We think of ourselves as Goldilocks size, not too large, we can't be nimble, and not too small, we can't do interesting things. But as soon as you start talking about robotic process automation, even in trusts like Kettering, folks think of shiny little robots. And it's about 5 minutes before you start talking about Skynet and Terminator. But once you get beyond that, you start to understand what RPA can help. And normally, I'd show the thing. But because this is recorded, I won't be showing the video because it displays personal information, but I will show the moderately complex work streams that gave the data for the COVID sitrep reporting. Here you've got 3 swim lanes, which shows at the top HR staffing data. The incident room, like all hospitals, we had an incident room managing the incident, and general reporting tools that managed our BI. And those different data sources range from SQL servers, Medway patient record applications, Microsoft Teams, other BI reports, and clinical audits. And so, yeah, our robot worker was called Marybot, in part named after our head of IT. And setting up Marybot was fun. Explaining to service desk that Mary can't sign a bit of paper. And yes, we do trust her with confidential data. And please, can she have access to that network share? Was a little bit of fun. And no, she can't be trained on Medway PAS. She just goes and gets what she needs. And I say, I do have a video, but I won't press play here. But what it would show is working through the systems, getting staff data, logging into health roster system, It gets data for each of the 7 different files required for the report, and that's just the HR process. Phase 2 and 3 involves combining 90 emails from the incident room and web forms to fit into the predetermined sitrep template. Marybot also communicates on Teams and sends emails throughout the process. So what did we learn from this? Well, time, which does equate to cost, but time savings can be significant. We need to build a benefits case over time to show how RPA does help, how it frees time up, but also build a case on the quality of the reporting and reducing risk and errors. That swim lane mapping process was quite interesting. We may need to map processes that have not been mapped before. We definitely need a new skill set in trusts, or look to retrain developers, analysts, integration type people. RPA and IA in general create some challenges for information governance and privacy. You can't put a robot in jail and you can't discipline them. We think RPA can help us with some interop issues in the short term in advance of our systems moving to open standards. And so what next? We've signed a 2-year deal with Blue Prism and Human Plus. We believe having a digital workforce will help us face reset and winter pressures. We've highlighted 5 areas where we think RPA could help us with, and you see them there. As you can see, all to do with admitting patients, managing outpatient appointments, potentially helping with antibody testing and reporting, pathology results, and clinical coding. And I should point out we are recent HSJ award winners. And I'd just like to say thank you. If you have any questions, if you want to follow up, you can find me in Twitterland at Ian Roddis, or contact me at Kettering General Hospital. Thank you.